All right, welcome and thank you for joining us this afternoon and for our weekly press briefing. Would like to talk to you about several things. I'm Tad Stone, the Director of Emergency Services, and we've actually started to see the total number of cases starting to slow off, and the number of cases reported on a weekly basis slow down a little bit throughout the county. And with that occurring, the fire department has kind of changed their response posture with our dedicated COVID response units. We have gone down to a single unit now, which continues to run 24 hours a day, 7 days a week. But this has been extremely effective for us in our ability to not only protect our workforce, but also to limit the exposure to all the equipment that we have out there, all of our ambulances and our crews, and we're able to not take so many units out of service in the process of decontaminating them over a period of time. Because we've starting to see that reduction of the total number weekly of cases throughout the county, the fire department is kind of shifting their mission a little bit, and we're actually going to start working with the health department, and I'm sure Miranda will talk about this in just a minute, to do some community outreach, continue to do some testing throughout the adult living facilities and the nursing facilities throughout the county, and hopefully that will start sometime next week. Although fire rescue has experienced some exposures to and the staff has experienced those exposures through the use of continued use of personal protective equipment, or PPE as you hear it referred to, the rigorous decon processes that we're going through, we've had no cases reported throughout our workforce of almost 300 employees. The virus will continue to be with us for quite some time. We certainly want to encourage everybody to continue to do the social distancing, the hand washing or the use of the hand sanitizers, the use of masks, and avoid large crowds if at all possible. Try to limit those crowds to no more than 10 people. I do want to shift gears just a little bit. In another week or so, we start into the hurricane season, so I want to remind everybody that that is coming up. And with the hurricane season coming up, with the shelters that we have to run if we have an approaching storm, and with COVID being with us, we're having to change our response posture for the shelters and the way we're doing business, and our emergency management folks are working diligently to try to get the change in the populations of the shelters in place, and they'll be messaging that out within the next 2 to 3 weeks. You have to remember that a shelter is a shelter of last resort. So we're encouraging people that, especially for the lower category hurricanes, to make arrangements with your neighbors or with friends out of town, so that you're not stuck in a very confined shelter space, and that you have a place to go if an approaching storm comes towards us. I want to remind everybody that the tax-free holiday for hurricane supplies starts on May 29th, and it goes through June 4th. And that's for generators, batteries, basic hurricane supplies, and that full list should be available on our website. We want to remind everybody to go ahead and start building their kit now and replenish their kit if they've actually gone in and taken items out of it, and have a weather radio available so you can keep up with the latest news from the National Weather Service. With that said, I'm going to turn it over to Jason Brown, who's the County Administrator for Indian River County.
All right, thank you, Chief. Good afternoon. Indian River County officials, we continue to work with our municipalities, the Sheriff's Office, and the Health Department to determine the best steps for carefully and strategically reopening our community. As the state and our community continue returning to our new normal, it is vitally important that residents continue to operate in the manner that allowed for COVID-19 to have the relatively minimal impact on our community that it has to this point. This includes continuing to wash your hands often and avoiding large gatherings and doing that social distancing. So again, wash your hands, don't touch your face, things Mom told you. As always, those are good wisdom at any time. We're currently in full phase 1 of the state's safe, smart, step-by-step plan for reopening. Restaurants and retail establishments are now allowed to operate at 50% capacity, as well as gyms and the retail establishments. Locally, we are also taking a thoughtful approach to reopening our community. Now, under the governor's full phase 1 plan, counties are permitted to submit plans to the state's Department of Business and Professional Regulation for the reopening of vacation and short-term rental properties within our area on a county-by-county basis. By taking into consideration the safety for potential guests and hosts, we have submitted a plan to the state that requires certain protocols for cleaning, et cetera, to be followed to protect against the spread of COVID-19. And once the state has reviewed our plan and approved it, we will provide information to the community on vacation rentals opening back up in our county. As we continue to progress through our thoughtful approach to reopening the community and businesses begin opening and others adapt to serve more customers, we must remember that we need to continue practicing the efforts to fight against COVID-19. We will remain committed to responsibly reopen our economy while taking those appropriate steps to protect the well-being of our residents. You can be assured that Indian River County will take into account the best interests of our community and the safety of our residents. Remember that the county, along with the municipalities within our county, are here for you and will continue to do all we can to keep everyone safe and provide accurate, timely information. Chief Stone mentioned hurricane season. Just want to reiterate that it's time to get your plan in place, and that sales tax holiday again begins May 29th and runs through June 4th. So that is a week from today is when you can go out there and start purchasing those hurricane supplies, and there will not be sales tax on those items. Remember that you can sign up for our alert system where you can get updates regarding COVID-19 or hurricanes or other emergency situations in our county by going to alertindianriver.com and signing up for that. For more information on county services going forward, you can also check our website at www.ircgov.com, which is updated regularly. With that, thank you, and I will turn it over to Miranda Hawker from the Health Department.
I think I kind of need a booster step compared to everybody else here, because they're about 6 feet tall and I'm 5'6". So please bear with me and let me know if you can't hear me. So our current number of cases is at 112, with 8 cases reported this week. There are 31 people with a history of hospitalization. The age range of our cases is from 8 to 95, with 57 men and 55 women. We've had 9 deaths. There are no new deaths to report this week. That is very, very good news. In terms of race and ethnicity for Florida resident cases, which is 101 of our cases, 9 of our cases are black, 68 are white, 17 are classified as other, and 7 are unknown. In terms of ethnicity, 8 individuals are Hispanic and 75 are non-Hispanic. 11 are unknown, or we have no data. We've had 19 cases in long-term care and staff. The health department continues to provide public health support to our vulnerable populations in long-term care facilities. We are acting in support of the directive to test all of the long-term care facility staff within 14 days. So we're currently working with the IMT in partnership with Chief Stone's staff for fire rescue, and we're grateful for that partnership. We are also beginning to do testing in our most vulnerable communities for those community residents only, so that's something that we're coordinating through the leaders within those communities. CDC, I want to just reiterate, and when we're talking about those good habits, and I remain concerned that people continue those so we do not have an increase in cases, to wear those cloth face coverings in public settings. Make sure if you have COVID-19, even if you don't have symptoms, it's important if you don't have symptoms, because many people can be asymptomatic with COVID-19. So we need to all practice good public health practices and wear our cloth face coverings. Frequently clean our hands. Make sure if you're at home that you're cleaning those high-touch surfaces frequently, that you're able to protect you and your family, and maintain your social distance of those 6 feet. So I know everyone is excited to get out, to go to stores, to go to the places that are open, to go to the beach, but it's important even there that you consider that perimeter of those 6 feet. And that way we can keep our number of cases down even as things are opening up. I do want to touch on a recent morbidity and mortality weekly report, because these anecdotes give an illustration to what everyone is experiencing as we're now starting to go places where we haven't been in the last few months. So CDC released high COVID attack rate among attendees at events at a church in Arkansas, March 2020 on May 19. So in communities where COVID-19 is spreading, in-person events can lead to widespread transmission. Among 92 people who attended events at a rural Arkansas church from March 6th through March 11th, a total of 35, that's 38%, had laboratory confirmed COVID-19 and 3 people died. At least 26 additional confirmed COVID-19 cases were identified among community members who reported contact with 1 or more of those 35 church members. 1 of those 26 people was hospitalized and subsequently died. Widespread transmission within the church and the surrounding community occurred despite the church canceling in-person activities and closing the church as soon as it was recognized that several congregation members had become ill. These findings show the importance of continuing to follow social distancing recommendations in affected communities, including staying at least 6 feet apart, avoiding large groups in crowded places, and staying home when you're sick. Please call your doctor if you think you have COVID. They'll evaluate you for illness and determine if you should be tested. Testing's available at CCIRH drive-thru and the health department. We're still doing the homebound testing, so if you are not well enough to leave your home, if you're at an advanced stage, if you're suffering from an illness that would prevent you from leaving your home, please call 794-7411 and we can get staff to you to do that testing. The health department has performed 179 tests, and currently we have the capacity to perform 1,130 tests. The total tests done in Indian River County are 4,583, with 112 positive and 4,470 negative, and 51 are pending. So at this point, I'd like to turn things over to Corey Richter, and he doesn't need a step. Get the microphone. Sorry.
Thank you, Miranda. All right, again, like it said last week, the hospitals, they're fully prepared to take people, and please don't think about not going to the ER if you have a medical condition just because of the COVID virus. They are separating it well and can handle the people any emergency at the hospitals, and especially the COVID if you have any signs or symptoms of that. So with that Cleveland Clinic, the total calls to their hotline to date now have been 7,006 calls, so just over 7,000 calls. An average this week of 116 a day. Their hotline number, just for reference again, is 772-226-4846. And that's open 9 to 5, Monday through Friday. They're not open on the weekends anymore, just Monday through Friday. Their numbers of testing, they've tested a total of 3,969 patients they've tested. 3,863 have been negative, or 97% were negative for them. They have 29 pending, which is a good number. Those pending numbers have been low, which means they're getting their results back quicker, which is good. And they're up to 77 positive now, but it's still maintaining that 2% of the numbers that they've been testing. They only have 3 in-house, and none of them are in ICU or anything. So they do have 3 in-house, but they're not serious patients. They just need further medical attention. They can't be home right now. Sebastian River, the testing numbers, they tested a total of 104. 95 have been negative, or 91% of it. They only have 1 pending and still 8 positive. They haven't had a positive for over a week now. So that's good. They're not testing quite the numbers that Indian River is, but Indian River has the drive-through, so they're obviously doing a lot more tests than they are. And that's all I have for that. Anyone has any questions for anyone?
I'd like to ask, of the 116 average phone calls a day to Cleveland Clinic, what is the nature of those calls? What are people looking for?
They're calling to try to get tested, see if they meet the criteria for testing, and then they make an appointment for them to come in and be tested. So, and they have opened up the testing, you know, they've been testing a little bit more now than they were, because it's not as narrow, the testing requirements, but they're still screening people through that. So you can't just walk in if you're asymptomatic, you gotta have some symptoms, but they opened up the symptoms and not just really COVID for specific symptoms like it was before.
So the majority of those calls are asking whether or not they qualify or
Yes.
should be tested?
Yes, they're asking whether they're either qualified, like you said, or whether they can be tested or not, or should be tested.
Thank you.
And you said there's 3 people in the hospital?
They have 3 currently in the hospital, and none in ICU though.
Okay, none in ICU.
None in ICU, and that's been that way for the last week, I believe. So that's a good sign. There are still people that are sick, but only 3, and nobody in ICU, so they're not serious. So it's a good sign the way the trend has been going. The deaths stayed the same. You know, we didn't have any more deaths this week, which was, again, good, like Miranda said. So we're hopefully this trend will continue, and we're on a good trend with the soft opening that we've been doing, and the way Jason has been opening up incrementally, you know, to not just open up the floodgates, basically.
I have a question for Mr. Brown about the vacation rental plan that was proposed to the state. If you could describe that process of what filing that plan was like, and if there's an estimated time on when you'll hear back.
So yes, we filed our plan with DBPR per the governor's executive order yesterday. That has protocols that are meant to ensure that this is done safely. We don't know when we will hear a response back. I can tell you that they've been very rapid in turning those around for other counties that have submitted them. Usually it seems not more than a couple days before they get those processed. So we anticipate that in the next couple of business days.
Do you know if there's an actual timeline for opening up vacation rentals?
Once we get approval from DBPR and we know what if they have any changes recommended or if they approve our plan, we will announce that on the county's website. So
And frequently, if any of you were here in H1N1, when we looked at our response to that, we have a history of partnering with the fire department, who's absolutely been amazing, and we've been able to share resources. And so that's quite an effective partnership, and it's really one of those model partnerships that the state looks at, and they encourage those type of collaborations. So yes, we do have adequate test supplies right now, and we do have adequate personnel at this point.
Thank you.
Anything else for me? Okay.
quarantine for 14 days, you cannot book, you would not be able to book a short-term rental or vacation rental for less than the 14-day time period, so that's a minimum. We also have a 24-hour gap required between the stays. We think that's important because sometimes if you have only 3 or 4 hours like you normally do in a hotel or a vacation rental for turnover, there may be a rush on getting the cleaning done, so we believe that the 24-hour period between rentals provides extra time for sanitation, provides extra time for hopefully, you know, anything to the coronavirus particles, if you will, to die over the course of that time period, and ensure that there is sufficient time to do the extra sanitation that's required.
So this will include rentals and hotels?
No, this only applies to vacation rentals. Hotels are already open per the governor's order.
Gotcha.
For the health department, I'd just like to know, I mean, now that the fire department is going to be helping out with some testing, you're going to be testing workers at healthcare facilities. Are you in short supply of anything? Are you in short supply of staff or personnel? You're getting help, but is that because of a shortage of necessary people?
So right now, we have adequate personnel between, and frequently, if any of you here were here in H1N1, when we looked at our response to that, we have a history of partnering with the fire department, who's absolutely been amazing, and we've been able to share resources. And so that's quite an effective partnership, and it's really one of those model partnerships that the state looks at, and they encourage those type of collaborations. So yes, we do have adequate test supplies right now, and we do have adequate personnel at this point.
Thank you.
Anything else for me? Okay.
All right, thank you all for joining us this afternoon. We do appreciate that, and we'll make an announcement if we're going to have another press conference by midweek of next week. Thank you for your time and your questions. Appreciate that. Thank you.
Thank you.